So here we are, PNR 204, Exam 1 review. Remember, Exam 1 review is pretty heavy on infants, growth development, definitions, and of course, your theorists, all right? So as we're going over those things, if you're not getting it, as I said, please stop me and let me help you and make you understand. I do try to make things as simplistic as possible. So if you still not understanding, please, I don't mind. So let's go over. First of all, we have a lot of definitions that are different and unique and special to the pediatrics and that we have to understand in order to take care of kids, right? So let's start. Cephalocaudal. Well, what does a kid do first? They lift their head, right? Cephalic, head. Cephalocaudal. Caudal is when they're walking. So development starts lifting their head, rolling over, creeping, crawling, and then on the toe, walking. That's head to toe development. Proximal distal is at first infants only see what's in front of them, and that's proximal distal. And then it starts working outwards, and then they start being able to see around them. General to specific refers to the ability to perform general physical functions. You start, grasping things, like the mom's hand, and then like now you want to grab your own toy. So now you're starting able to do that. Maturation is the total way in which a person grows and develops as dictated by inheritance. So the genes that you're given is the way you grow. You're not going to be tall if your whole family's short. So that's that maturation, why that inheritance is there. Growth is just an increase in physical size. Infants at 6 months, they're double birth weight. That's a growth. And also every inch, every month is an inch of growth. That's growth. Development. This refers to the progressive increase in the body's function. Well, at first, their intestines don't work, right? And not that well. And then at 6 months is why we start introducing rice cereal and foods, one at a time, 4 to 7 days apart, because now their intestines are getting able to handle some food. Heredity is a factor that develops your maturation. Again, this is more about where you're coming from, what you get from your parents, and it does tell you who and what you're going to be. Nuclear is that traditional family. Mom and dad marry and have children, and they stay together forever. That is a nuclear family. Extended families are those grandparents. It's other parents, other children and relatives, and they're all part of your family, but they're called extended. Blended is when you get divorced and get remarried, and there's children on each side. And that's remarried individuals. They both have children. That's me and my husband. He's got 3 girls, and I've got a boy and a girl. And together we've got, I can't even tell you how many grandchildren now. They keep coming and coming, and it's wonderful. Alternative is that communal family. That could be a church family, or it could be like the migrant workers. They consider themselves a family and work together. Exclusion reflex. Well, when we start to feed a baby at 6 months, they're used to sucking on a pacifier, on a nipple, whether it be on a bottle or the breast, right? Well, when we take that spoon and stick it in their mouth, they don't know how to put it in and suck it down yet. So initially, the baby has an exclusion reflex and they stick their tongue out. And it's like trying not to get the food. They don't know how to handle it yet. Now, let's go into the grasp reflex. Well, we start with that palmar grasp, and that is that reflex where we just grab mommy's hand. Now, when it gets to the point where they get a rattle and they grab it their own, that's called voluntary, okay? That's your grasp. Prehension is that ability to grasp those objects between fingers and the thumb. It's almost, you're picking up little things and getting them. It's called a pincer grasp or prehension. Parachute reflex is when you take a child that you turn over and put them down, their arms and their legs come up. It's like a parachute. They think they're falling. So that's a protection type of device. So turn them down, put them down, and they are going to come up, hands and the feet. Negativism is your toddlers. No, 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 no. Mine, mine, me, right? No to everything, no matter what they're saying. That is negativism, and that's a toddler. Another thing with toddlers and what they need is ritualism. They like to have a schedule. When they have a ritualism or a schedule, they have a sense of security. They know what's coming next, and that's calming for them. Personality is defined as the unique organization of characteristics that determine the individual typical or recurrent behaviors, patterns of behavior. It's who and what you are. Are you the smiler or are you not, right? You the quiet child or are you the talkative child? That's personality. Parallel play is when kids play next to each other. They don't share, but they're next to each other playing toys. Again, this is toddlers. They don't share because they're egocentrical, which means egocentrism is they only know me, they don't know anybody else, and they're not going to share. So growth and development, what influences these things? Well, we've gone over, heredity, that's part of the influence that will influence growth and development, your nationality and your race, and that ordinal position within the family. Are you first? Are you last? In the middle? It makes a difference. Are you boy or girl? And what sort of environment are you brought up with? Are you getting all the food you need? Are all your basic needs met? Do you have clothing? Do you have shelter? Environment is a big thing also. So those are growth and development, those 5 things. Now, parenting, there's all different styles. We have the authentic, which is nurturing, affectionate, your boundaries, they discipline, but you understand why, and then that open communication. And then you have the parent who's authoritarian. These are the ones that are strict by the rule. You have to be, you have to do, this is what I want from you. And it's very high expectations. Indifferent is they really are not paying attention to the child. So they're emotionally detached, which means they're not watching them. They're doing what they want. So no boundaries. And there's not a lot of interaction between them because the parent doesn't pay them attention. They're self-absorbed. The permissive is nurturing their affection, but they're inconsistent. And permissive, they want to be the child's friend. Whether or not that's the right thing, that's the type of parenting. So discipline should be focused on teaching rather than punishment. As in, well, you did this, it wasn't right, you should have done it like this. Now, explaining it, it says, oh, go on timeout, right? Go right away. Well, if you don't explain what they did wrong, a child might be misconfused, right? Confused what's happening. So what is a timeout? It is 1 minute per year of age, and it's where you explain it, hopefully what you did wrong, and then when they stop crying is when the timeout starts. And then always there should be limit sets, you can't do this, don't do that, or no, at 6 o'clock at night, please don't take out your Legos now, I'm not picking them up, or that, limit, you always have to say where they have to stop. Now, Freud. As I said, you are going to see questions about the theorists. That's like about 7 of them on most of the exams. They're all a little different, but there's a lot of theorists in here. Now, Freud, what does he say? Now, let's go to this page because it goes into a lot of it. As you are going through and studying, you can look at this, but let me explain my thing. So Freud's sense of orality, as in infants. Well, what does an infant know how to do? They suck, they swallow, they breathe. Their mouth is how they decrease stress. The mouth is how they explore the world. Baby, what do? Everything in the mouth, whether it's a pacifier, a rattle, a toy, a finger, a blanket, a animal, whatever, in the mouth, right? That's oral, which is the infant stage. Now, anality is all about the toddler and going through potty training, right? It also is about giving it exercising. No, but more over than that, Freud says you have bowel that will be trained before bladder. So anality or the anal stage is about that potty training. Now, preschoolers start to understand the difference between boys and girls. They start touching themselves and even masturbating, normal at the preschool age. And it's called the phallic or the oedipal stage, okay? And this is all about learning boys and girls, knowing difference between moms and dads. And then Freud's latency is about, latency. What does that mean? Well, Freud, again, is all about sexuality in people. Well, in school age, they say it's same sex peers. So they start getting friends now. They're breaking away from just family. Now, Piaget. There are 4 different stages. Sensorimotor, and these are the ages, you'll see them, 0 to 2. Again, sense is touch, feel, oral, mouth, motor, making it move, right? Also, this is where they start to develop object permanence. And we've discussed that. That's about taking a toy. Let's say it's that rattle they want to put in their mouth. And you put it in front of them, but maybe behind something when they're on tummy time. What they do is they try to get to it because even though they can't see it, they saw you put it there. So it's still there. They understand even if they can't see it. Pre-operationals, they start thinking about things like taking that sippy cup. But it fell on the floor. Well, now I know mom will come. Let me just hit it off myself. Or it's also putting the arms up and being an airplane or using a stick as a broom or a broom as to be flying or a stick, it's going to be your sword. This is all that imagination. That's also about animism, and trees come to life and they have leaves to keep them, from getting wet when it rains. I mean, there's all different sort of things. As we get older, the concrete is more concrete, just think of it as it is firm, it's set. These are things that a child has already experienced. They already know it, they've seen it. And after a couple times, they can say, oh, I saw that happen, so I can do that too. Whether it's, doing something or making something, it's now they've seen it and know it. Now, adolescents don't have to see it. They don't have to know it. They just have to have some ideas about things and they can figure it out. As I say, the formal operations on an adolescent is when mommy told them, you can't go out this weekend because you did whatever it was. And that's on Monday night. Well, on Tuesday, Wednesday, Thursday, Friday, they get A's on their tests. They make their bed. They help with dishes, whatever it is that they know that mommy now, okay, you've been good all week. Yes, you can go out. And those are basically what I've just said right there. Concrete operations, There's a couple other examples here, but I think you understand. It's something that you start to use. Now, Erikson, probably the most tested, which will go from infant up to that 13-year-old, which is industry versus inferiority. Now, let's talk about what those things are. No, number one, you need to know the names of these stages. Those are important, okay? So if we look at the names, we can figure out what it's talking about. Well, trust versus mistrust. Well, what does an infant need? Well, they need to be fed when they're hungry, and they need to be changed when they're dirty, and they need to be held when they want comfort. So trust is when all their needs are met. Mistrust is when they just don't get it. And it's not one time, it's consistently they're not getting their needs met in a timely fashion. It could be in a family where they're homeless. It could be drugs, alcohol, abuse, could be other things. But trust, they're happy, healthy, smiley children. Mistrust, they tend to be quiet and distanted. And even in an infant, you can see that. Now, toddlers are all about autonomy versus shame and doubt. Well, we've talked about that egocentricity, right? Toddlers are ego, all about me, mine. They really don't think about other people as in sharing, okay? So autonomy is me, mine. It's all about me, not sharing toys. And that shame and doubt is when the parents, the grandparents, stop them from doing things like jumping off the couch onto another couch when a parent or somebody thinks they're going to hurt themselves. Toddlers need to be allowed to do some things to learn. We know that they're learning to potty train, self-feed, maybe the spoon's upside down backwards, but it's okay, self-dressing, and then learning how to say, hey, what do I need? Now, preschoolers are those initiative versus guilt. Preschoolers at that stage, they want to help, they want to do things, but they feel guilty because they can't do everything because they don't know how yet. School age, I think this is probably one of the most tested areas. You'll see it on ESSE, you'll see it on your NCLEX. And at school age is all about industry versus inferiority. Now, think of industry as a building, a factory, something that you've made that's producing something. Well, that industry is, I have, I always win the spelling bee, or I'm really good at art. I play the piano better than anyone, or I throw that ball faster, or I run faster. I do a task well. Well, these school age children can't do everything well. So the stuff that they struggle with, and it could be math they can't do, right? That's the inferiority. And then the last stage, adolescence, is all about identity, role confusion, and it's all about who am I? It's all about body image. It's what do I want to be? It's, what group do I fit in? And then it's making those choices in friends and relationships and, figuring out where do I fit here? Now, Maslow's hierarchy of needs. Well, look at the first stage. That's just physical needs. That's food and shelter, right? And that's a place to sleep, be in comfort. Then it goes into safety, it goes into love and belonging, and it goes all the way up to esteem, as in you have your child who throws a ball really fast, runs fast. That'd be a child that you'd put in Little League or you'd put in gymnastics or something because it makes them feel good, gives them that esteem. Now, Kohlberg's all about right and wrong and a consequence for them, right? Well, infancies don't know. They might, as because infancy, that's a little bit of toddler. If you look at the age ranges, they sort of know how to avoid punishment. But it's really they don't understand. It's when they get to preschooler. Now, preschoolers want that reward. Okay, so it's reward and punishment. All right, they know if they do good, they'll be rewarded. They do something bad, they'll be punished. School age children, they want to please. They're pleasers, okay? And then as they get older into that, adolescence, they conform to rules of society, as in they learn how to be polite. They learn how to be meetings on time, as simple as driving, stopping at a red light. These are rules that are made that they all follow. And that's Kohlberg in the Adolescent. And that goes into it. So infants, let's go into some growth and development. The first 28 days or 4 weeks of life, they're known as a neonate. From there to 1 year old, they're known as an infant. When they're born, let's say they're born at 7 pounds. At 6 months, they double, they should be 14 pounds. And they're going to be 21 pounds or triple by the end of the first year, which will be at 12 months. For the first 6 months, they grow an inch per month. And usually an average infant's about 29 inches tall by the end of first year. Big milestones, well, by 1 year old, they should be standing, attempting to take steps, or already walking. And the earliest, usually, tooth eruption starts. And remember, it doesn't mean all kids are going to be walking by 1 year. It's that standing up, attempting. And then tooth eruption, some children at 6 months are getting teeth, and it's usually one per month. Again, that development of trust helps with a healthy personality because they're happy. They understand what's coming. Their needs are met. Sensory stimulation really, really helps with understanding thought processes. And again, who is this? This is Piaget. Again, sensoriomotor, texture, sounds, colors in the mouth. Infants, because that's how they explore and that's how they self-soothe. Now, sometimes you have an infant who is more down, more lethargic. These children, you do not need to overstimulate. So how do we take care of them? Avoid those bright lights. Don't move them quick, go slow, no loud voices, no screaming, and then calm voice, and then sitting the infant, up. Let them just look around very quietly. During the first year, it is so important that they get all of these visits. We know they're right after they come home, they're visited 2 weeks, at 2 months, 4 months, 6 months. Very important things because we're looking at growth and development, and we're going to give all those immunizations. Safety, very important with infants because they don't know any better. So never leave an infant in a bath or on top of anything, a bed, changing table, even a couch. Because remember, at 6 months, they're turning completely over. So they will turn over and they can drown or they can fall and hurt themselves. Now, SIDS death is the first year of life. They promote them to go on their backs, supine, for sleeping. And the only time that they should be prone or on their abdomen is what we call that tummy time, right? Where they're very awake and very alert. Automobile seat should be in the car seat, should be in the back, rear facing, up to age 2. And at 2, we can turn it around. What they're saying is the car seat, when many parents do it. The kid falls asleep, so you bring him in the car seat. What they're saying is it shouldn't be used as that sleeping device for long periods of time, okay? They're not going to get the best sleep that they should, and they could kink their airways there. And the one thing I didn't mention, it should be in the center of the rear seat, and make sure it's in there securely. The sling carrier are great, but just make sure that their mouths are not obstructive and they can breathe, okay? Because it can suffocate them. For the first 6 months of life, breast milk or iron fortified formula. We introduce solid foods around 5 to 6 months, one at a time, 4 to 7 days in between. And we know if a mother, for whatever reason, can't breastfeed, the other thing is iron fortified formula, and that's a second choice. Now, some parents don't want to, at time where they're going to feed food to their infants, getting into vegetables and fruits. Some parents like to cook them, but there's certain things they need to know. You should never add salt at all, and sugar extremely sparingly, just a little. No honey or cow's milk before age 1, because they should not be introduced before age 1. When they're cooking those foods to get nice and soft, make sure there's as little as water as possible, and then strain it or puree it. Put it into ice trays. And they say just take out 1 cube every time you're going to feed that baby. And that's a single serving. Rice cereal is the first thing that we introduce because it's a hyperallergenic or low risk for allergens. The fruits, the vegetables, the meats, you should pick out good stuff, not the cheap stuff, if we're going to make it. And single ingredient food should be introduced. We don't use things like mixed vegetables. You start out with just peas or green beans or sweet potatoes. And fruit juices should not be offered until 5 or 6 months. And you should give that in a cup. Alcohol. This has always been a controversy with pregnant women. But what it said, there's no safe level of alcohol ingestion during pregnancy. It does cause growth restriction, intellectual impairment, facial abnormalities, and then impaired adaptive functioning. Their communication, social skills, their ADLs, motor skills. And they say 1 12-ounce beer or a wine cooler or a 5-ounce glass of wine or 1 shot of hard liquor once a day can cause serious effects. So even 1 drink a day is not recommended. So let's look at toddlers. Toddlers are ages 1 to 3. At 3, then it's preschooler. Before that, infant. By the age of 2.5, the birth weight has quadrupled. So that 7-pound kid should be about 28 pounds. They're starting to get better fine motors. They can use their hands better. They can hold things, throw things, build things better. Those gross motor, walking, running, getting more and more less awkward and clumsy looking. Their eye to hand is getting so much better. Their depth perception. They are now starting to be aware of when they have to urinate, when they have to move their bowels. And they say that when you put a kid on a toilet, you should not leave them there unattended. You should be there with them. And it shouldn't be used as a punishment, because that makes them not want to go to that toilet. I mean, kids are going to have accidents. It's just what they have. Now, up to this point, you're feeding infants every 3 to 4 hours. Well, when they become toddlers, they can go on those 3 meals a day, maybe a snack in between, but they can do that. They should be able to feed themselves by 2 years of age. And you should never decrease the fat in a diet before age 2, because we need that for growth and development. And potty training, bowel bladder control, usually, they're not all, usually achieved by 2.5 to 3 years old. Again, Erikson's all about a sense of autonomy, self-control, right? And we know it's everybody else telling them, be careful, don't do that, watch out, you're going to hit that, that makes them like question what they're doing. And that's how kids learn, allowing them to do things. We know that their language and understanding becomes more. We know that there's different levels of separation anxiety. You have to leave a kid in a hospital, they're going to cry, then they're going to regress, and then they're not going to pay attention to mom when she comes in the room if it's been gone for a while. It's very hard as a parent because these children are no, 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 me, me, mine, mine. They're having temper tantrums, and it's difficult because they're going to be arguing and bickering with their younger or older brothers and sisters. Again, discipline should be aimed at you're teaching them what they did wrong. And it's not a punishment, it's just time out, sit there. Preschooler is all about getting ready for school. We are now to the point where we need them to work together with other kids. So, group play, which is also cooperative play, which in cooperative play, somebody wins. It's 2 or more children playing together with a goal. Something's going to happen. Somebody wins. They are now going to be potty trained. They're going to be more acceptable to be separated from mom and dad. They are talking, understanding more and more, and they remember everything. Attention span, preschool is about 15 minutes, but they're able to sit longer. These are ages 3 to 6 years old. Now, the gross and fine motor skills are becoming more and more developed. We know that they're able to button their shirts. By 6, they're tying their shoes. They're running, skipping, drawing, all of these things. They're getting more and more able, and it's less awkward. They're starting to be more in this magical thinking, right? Symbolic thought processes. They're thinking and they're magical and their language is coming. So preschoolers are that development of initiative. Let me go help mommy put the napkins on the table. Let me go put my dirty laundry in the laundry basket. Let me put my shoes where they belong. These are trying to do things that they know are right. And again, Kohlberg is all around about punishment and reward, but also with Kohlberg, they start to see what other kids, being more understanding about other kids and what they might need, trying to be good. As I said, language is amazing. They're learning quick. They have these complicated sentences with words you don't know where they came from. We know that they're playing. We're doing that cooperative play. And of course, that imaginative, magical thinking play. Social issues with these children is they need to learn how to share and how not just to scream and yell when they don't get their way, especially if they're started into preschool. They have to control that. It's not acceptable behavior. Parents need to know how to set those limits. Jealous between other siblings and children is something they have to handle and deal with appropriately. And if they're still sucking their thumb, what are you going to do? They say, as long as they stop sucking their thumb, usually before they enter school, which is when baby teeth go out and the permanent teeth come in, is when they should stop thumb sucking. And as I said, they do have these ideas and masturbation. How does a parent handle that? Well, if they're in the middle of a room with everybody, you say, stop doing that, go to your bedroom. You know, it's something that's private that should be handled that way. Primary enuresis, we know this is bedwetting. This is where kids never been dry. Secondary is when something happened. Maybe it's diabetes, whether mellitus or insipidus or urinary tract infection. Something happened to cause them to be wet, and it needs to be explored. There's a couple of these growth charts here on different things. I'm going to leave them there for you to say, but I've really covered over the key things. Now, school age children, ages 6 to 12, now they're getting more independent, more time away from mom and dad. Now they're with their same sex peers, right? They become important and they start learning other cultures and other people. Erikson, as I said, it's when they take their industry, their factory, what do they do well and feel great about it? And whether it's, playing a piano or winning the spelling bee or running the fastest or hitting the ball the hardest, that is the task, the industry they do well. Again, Freud's all about same-sex peers, and Piaget saying they do things and think about things, and they could do things based on what they've already learned. That is that concrete. I've seen it, touched it, felt it. All right, how can I apply it? How can I do that? Again, after infancy, growth is really small. It's, it's a little bit at a time, little weight at a time, but school age 6 to 12, when it's done, it's a lot by the end of those 6 years. And again, school is that second place for socialization. Before this, it was mostly your home. So now they're learning a lot more about a lot of other people. Language is getting more. They have the ability to communicate well. Sometimes at the beginning of school age, they're using words that they don't really understand. I mean, teleportation was one that my grandson would use. I'm like, do you understand what teleportation is? And where did you learn that word? And then it's, of course, parent, grandparent explaining what those things are. Now, Kohlberg, they want to please. They know right, they know wrong, they want to please. It's all part of it. They adhere to the rules because it's the right thing to do. Playing sports, as I said, it's that esteem of Maslow. When they do something well, a parent should, let that kid do it, whether it's sports, whether it's, something that they like, whether it's playing a piano, make sure that they have that ability to explore that because that makes them feel good. A child who's struggling with focus and attention, well, is this an ADHD? Is this something that needs further investigation? And if you have a child like that, working with school nurses can help. And then that latchkey kid. Many times today, both parents have to work. And you have a young school age kid coming home and they have their own key. They have to get in to the house. And there's certain rules that are expected, but the kid's alone. So one of the things that we have to be aware, they're unsupervised, they're home, and they're at higher risk for accidents. And because of that time alone, depending on when parents are getting home, they might have a feeling of being isolated and being alone. Now, adolescence. This is when you start the appearance of those secondary sex characteristics. What do we say? Women, it's, breast buds, and males is testicle enlargement. And through Tanners, we go through the whole stages till we go through full puberty, right? Again, Erikson's all about a sense of identity. Body image is huge with it. Like, that's my initial identity. But then, do I like girls? Do I like boys? Do I like both? Do I like none? What am I going to be when I grow up? What career? What college? all of these identities. And it's really hard to do those things. Freud is all about that psychosexual. And again, that's that experimentation with the genital age, a genital stage. You know, the girls, the boys, whatever it is starting to learn, you know, that sexuality. Piaget, as I said, is all about formal operations, abstract reasoning and logic. How can I get mom to let me go out on Saturday when she already told me I can't? What can I do to get there? And let me tell you, adolescents do think that way. We know the physical development is all the insides, the reproduction. It's the ability to have children. It's the beginning of menses. So in the beginning, the primary challenges are they're going through all of this rapid growth. They're going through physical change. They're getting breasts. They're getting curves. You know, their testicles and their penis are getting bigger. They're getting hair. All of this stuff is part of the adolescent things. And number one hazard and kills many adolescents, any stage, motor vehicle. So know what your nursing process is. We know you assess, you look, collect data, you plan what you're going to do, then you do it, and then you go back and evaluate it. So sometimes with looking at children, it's determining appropriate nursing issues or diagnoses relating to parenting, coping, and unmet developmental needs. So it's not just all about figuring out what they have. Remember, we got parents, we got all different ages, all different developmental levels, and how are we going to do it? That's what makes children unique. Now, Denver 2 is nothing to do with an intellectual score. All it does, it means that you are looking at their personal, social, fine motor, language, and gross motor abilities. All it's telling you is you need further evaluation, okay? Which would go and they would do more of evaluation. Does it need speech? Do they need a physical, occupational therapy? And that's what it says. You need further. Timeouts, as I said, 1 minute per year of age. Let them know what they did wrong and then start it when they're quiet. Now, BSA is the most accurate method for calculating appropriate drug doses. I know we use milligrams, micrograms, units per kilogram, but when you look at most accurate, it's the BSA. And how do we teach sex education to your adolescents? Well, number one, find out what they know and what they ask. You give them written and oral information so that they have it in front of them and they can make right decisions, because adolescents can get their own sort of birth control. They don't need a parent to do that. And again, leading cause of death among children, and you could put it even there, unintentional accidents. Medications, again, we know it's the BSA. I just told you, usually it's milligram, microgram per kilo. Remember, just like your elderly, absorption, distribution, metabolism, excretion is completely different. I mean, their stomachs don't work as well. Their liver, their kidneys, they might hold meds longer. And these are things we need to think about, just like the elderly, right? And when we give an IM injection, that site is their upper outer thigh or their vastus lateralis. IM injection for adolescents is either up in the arm, the deltoid, or their ventrogluteal, not in their thigh. Careful observation of any child with IV fluids. Now, you have a 7-pound infant, and all of a sudden they get 100 mLs of fluid, they're going to be in congestive heart failure. So very important that we put them on an IV pump, if absolutely that we have that, because we want to make sure they're not going to get fluid overload. Important because infants, how do they take care of themselves and soothe themselves? And what's part of growth and development is sucking. They should have a pacifier whenever they can't eat, whether it's due to NPO for surgery or because of a physical condition. How do you figure out output? Well, you get a diaper. The size one is 30 grams. When you take it off of an infant and it's 60 grams, when you weigh it, the difference 30 minus 60 is 30 grams. Well, 30 grams is 30 mLs of fluid. Okay. One of the other things is remembering CPR. Some of the important things is kids getting stuff, lodged in their throat. So remember chest thrust, back blows, and older children is that abdominal thrust. So medications, calculations, these are the type that you're going to see. You want to know milligrams per kilogram per dose. You want to know to take pounds, make it to kilograms. You want to know how to give a dose if you're given a dose and what's available on hand. And then how to calculate proper dosage based on the milligrams versus mLs. And then one of the questions we threw here is tetracyclines. Now, back in the 50s and 60s, we used to give tetracycline, but it causes graying of the teeth. So we don't give it for younger children below for 8 years old. And that's what I have for today. I will be sending this out to all of your professors. Those who are here, thank you for coming. Any questions at all?
Yeah, I'm confused because the schedule we were giving self